Speaker and colleagues, the health situation is grave, and we believe that we have taken difficult but essential decisions. We have to make space for the health service to deal with the serious rise in case numbers, and as always, we pay tribute to everything that our health and social care colleagues are engaged with to keep us safe and to save lives. The vaccines programme is well underway, and we're looking forward to seeing the results in coming weeks and months. This is our way out of COVID-19, but we are not there yet. The Health Minister will provide more information on this, but we wanted to say how grateful we are in the Executive to everyone who is taking part in the vaccination programme, to individuals who are taking the vaccines for all of the logistical arrangements, and to colleagues in the Department of Health who are leading a major operation which will benefit us all. The vaccines programme are in their early phases, although the numbers who have received the vaccines are already very encouraging. While these programmes grow and expand, it is necessary to put additional restrictions in place to build on the substantive steps we took last year and in December in particular. We will be asking everyone to help us get through the next period of time by complying with the public health messaging and by adhering to the full range of restrictions, because it has never mattered so much. We are also asking schools, teachers, parents, children and the wider education community to take very difficult steps now. We have been there before in Wave 1, and we made it a priority to avoid impacting on schools again unless it was absolutely vital to do so. Unfortunately, it is not possible to protect the health service and keep people safe without taking steps now with schools. The bricks and mortar of school remain open for children of essential workers and vulnerable children, but the vocation of education will continue for all through online learning, and we thank everyone involved in that. We have taken this step most reluctantly. We are acutely aware of the impact on children and families, and we will want to return to face-to-face schooling as soon as we can. The Education Minister will outline the arrangements and the factors the Executive took into account, but we wanted to say in advance that we are pleased that childcare arrangements will continue and that SEN schooling will also continue, and we appreciate how important these are. We're also underpinning our stay-at-home message through our regulations, and we are asking everyone to stay at home unless there are good reasons for leaving your home, and even then to stay at home as much as possible. The virus passes and transmits when people are together, so staying home makes a significant difference and helps break the chains of transmission. There will be police powers to direct you home if you are not following the regulations. We totally appreciate the gravity of this step, and again we do so reluctantly. The Justice Minister will provide details to the committee. And we wanted to say we did not take this step lightly, and we know that the PSNI will do everything that they can to first engage and explain before turning to their powers. Taken together, the measures we introduced in December and our decisions this week amount to difficult circumstances for everyone, and we understand this. Businesses are closed, our freedoms are restricted, we cannot see our loved ones in our homes. And we do not take the simple view that we did this in March and we can easily do it again. We understand it is difficult to return to these arrangements again. We put our trust in the fact that people will see the difficult situation we are all in and the need to dig in and again to stay safe, protect the NHS and save lives. We will keep the situation under constant review. The Health Minister keeps us fully briefed on issues from the health and social care sector. And the Minister for the Economy advises us on the economic impacts, which we know are being felt acutely. And all other ministers keep us fully appraised of wider impacts. We will come through this, and the vaccines programme, which is a credit to the dedication of the scientific community as well as our health and social care sector, will be our way out of this. But in the meantime, there is a lot to do. We need to follow the health advice at all times and do everything we can to stay safe, protect the NHS and save lives. And we have said before that the small daily acts of washing our hands, keeping our distance and wearing face coverings all add up. They remain vital and are more than the sum of their parts. We have more difficult weeks, colleagues, to get through and months ahead, but we will get there together. Thank you.